Dear all, life is a precious gift, but to protect that gift, we need to be aware of our own health. One of the most dangerous diseases for humans, especially the elderly, is cancer. Today, I stand here to share with you 4 warning signs in the morning that we should not ignore, because they can be the body's warning of the appearance of cancer. First, bad breath of unknown origin. Bad breath of unknown origin can be a sign of many serious health problems, especially when it persists despite thorough oral hygiene. In addition to common causes such as bacteria in the oral cavity, dry mouth, or gum disease, bad breath can also be related to dangerous diseases. Digestive diseases such as gastroesophageal reflux cause acid to reflux into the esophagus, causing bad breath, while stomach ulcers or Helicobacter pylori infection can create compounds that cause unpleasant odors. Late-stage stomach cancer can also cause bad breath due to mucosal damage and abnormal cell breakdown. The liver is an important detoxification organ, and when weakened by hepatitis, cirrhosis, or liver cancer, toxins are not eliminated effectively, leading to a characteristic breath odor, often called liver breath. Similarly, lung diseases such as chronic pneumonia, tuberculosis, or lung cancer can also cause bad breath due to bacteria or the breakdown of cancerous tissue. Some metabolic disorders are also associated with bad breath. Uncontrolled diabetes can cause breath to smell like acetone due to ketoacidosis, while kidney failure causes a fishy smell due to the accumulation of toxins in the body. In addition, ear, nose, and throat infections such as sinusitis, tonsillitis, or pharyngitis can also cause bad breath due to the growth of bacteria in the infection sites. If bad breath persists for an unknown reason, especially when accompanied by symptoms such as stomach pain, indigestion, prolonged cough, unexplained weight loss, or fatigue, you should see a doctor soon to rule out dangerous diseases. Second, prolonged abdominal pain in the morning. Prolonged abdominal pain in the morning can come from many different causes, from common digestive disorders to serious diseases. If the pain only occurs occasionally, it may be due to an unreasonable diet or lifestyle. However, if every morning you wake up, you constantly feel a dull or severe pain that lasts, this may be a warning sign of more serious problems. Gastric and duodenal diseases are a common cause of abdominal pain in the morning. Gastric and duodenal ulcers occur when the stomach lining is damaged by stomach acid or Helicobacter pylori bacteria, causing pain to appear when the stomach is empty, accompanied by belching, nausea, or burning in the epigastric region. Gastroesophageal reflux can also cause morning stomach pain due to stomach acid refluxing at night, irritating the esophagus and causing discomfort upon waking. Hepatobiliary dysfunction can also lead to early morning abdominal pain. When the liver is impaired due to hepatitis, cirrhosis, or liver cancer, it can cause dull abdominal pain in the right upper quadrant, accompanied by loss of appetite, bloating, and unexplained weight loss. Gallstones or cholecystitis can also cause severe pain in the early morning, especially after a fatty meal. Several chronic digestive syndromes can cause morning abdominal pain, including irritable bowel syndrome, a functional intestinal disorder that causes abdominal pain, bloating, and diarrhea in the early morning, and chronic colitis, when the colon lining is irritated in the morning, causing abdominal pain accompanied by frequent bowel movements. Persistent morning abdominal pain can also be a warning sign of gastrointestinal cancer. Stomach cancer often causes dull abdominal pain, bloating, indigestion, and rapid weight loss as the tumor grows. Colorectal cancer can cause blockage, abdominal pain, and digestive disorders, especially if accompanied by symptoms such as weight loss, loss of appetite, poor digestion, or black stools. In addition, some other causes of abdominal pain in the morning include stress, hormonal imbalance, worms, or inflammatory diseases in other internal organs. If the abdominal pain persists for a long time without a clear cause, especially if accompanied by unusual symptoms, you should see a doctor early to detect and treat underlying diseases promptly. Third, hoarseness and difficulty breathing in the morning. Hoarseness and difficulty breathing in the morning can be a warning sign of many serious health problems, especially if this condition persists without being related to common infectious diseases such as colds or sore throats. When the voice becomes hoarse and breathing becomes difficult right after waking up, this can originate from disorders in the respiratory system, vocal cords, or even malignant diseases. The vocal cords are responsible for producing the voice and also participate in the respiratory process. When damaged or inflamed for a long time, it can cause hoarseness and difficulty breathing in the early morning. Gastroesophageal reflux is one of the common causes when stomach acid flows up into the esophagus at night, irritating the vocal cords and making the voice hoarse in the morning, accompanied by a burning sensation in the throat or heartburn. In addition, polyps or benign tumors on the vocal cords can cause hoarseness and mild difficulty breathing in the morning due to thickening of the vocal cords due to prolonged talking, shouting, or smoking. Prolonged hoarseness, especially if not related to common infections, can be a warning sign of nasopharyngeal or laryngeal cancer. Nasopharyngeal cancer can compress the nerves related to the voice, changing the pitch and causing difficulty breathing in the morning, accompanied by nasal congestion on one side, tinnitus, persistent sore throat, and swollen lymph nodes in the neck. Laryngeal cancer directly affects the vocal cords, causing the voice to become hoarse, loss of voice, and causing a feeling of obstruction in the throat and difficulty breathing, especially in the morning when the body has not adapted to the compression of the tumor. Difficulty breathing in the morning can also be related to diseases that affect the lungs and airways such as asthma, chronic obstructive pulmonary disease, COPD, and lung cancer. People with asthma often experience difficulty breathing, coughing, and chest tightness in the morning due to constriction of the airways after a long night. Meanwhile, COPD often occurs in people who smoke for a long time or are regularly exposed to dust and smoke, causing dry cough, hoarseness, and difficulty breathing in the morning. More dangerously, lung cancer can compress the trachea or recurrent laryngeal nerve, causing hoarseness, prolonged difficulty breathing, coughing up blood, weight loss, and chest pain. In addition to serious illnesses, some other factors can also cause hoarseness and difficulty breathing in the morning, such as dry and cold air when sleeping in a low humidity environment or continuous use of air conditioning, causing the vocal cords to dry out, or the habit of smoking and drinking alcohol, which damages the laryngeal mucosa and increases the risk of cancer. If hoarseness and difficulty breathing in the morning lasts for more than 2 weeks, especially when accompanied by symptoms such as persistent cough, weight loss, swollen lymph nodes in the neck, or unexplained sore throat, you should go to the hospital for a thorough examination because these signs can be indicators of serious illnesses such as nasopharyngeal cancer, laryngeal cancer, or lung cancer. Fourth, persistent cough or coughing up blood in the morning. Prolonged cough or coughing up blood in the morning is a sign that cannot be ignored, especially when this condition persists and is not related to a cold or common respiratory infection. If you wake up every morning with a persistent dry cough, cough with blood in your phlegm, or feel a sore throat, this could be a warning sign of serious diseases related to the lungs, respiratory tract, or circulatory system. Lung cancer is one of the most dangerous diseases associated with persistent cough, especially coughing up blood. When tumors form in the lungs, they can irritate the respiratory tract, damage small blood vessels, and lead to coughing up blood. Initially, the patient may only have a dry cough or a mild cough with phlegm, but over time, the cough becomes more persistent, accompanied by blood in the phlegm, chest pain, shortness of breath, and unexplained weight loss. If lung cancer has spread, it can affect other organs, causing prolonged fatigue, hoarseness, and bone pain. Tuberculosis is one of the leading causes of persistent cough and coughing up blood in the morning. Tuberculosis bacteria attack the lungs, causing damage to lung tissue and inflammation, leading to persistent cough, mild fever in the afternoon, night sweats, and weight loss. If not treated promptly, pulmonary tuberculosis can progress to severe, causing respiratory failure or infecting people around. People who smoke for a long time or are regularly exposed to dust and smoke are at high risk of chronic bronchitis and chronic obstructive pulmonary disease, COPD. Both diseases cause a persistent cough in the morning, accompanied by thick phlegm, difficulty breathing, and sometimes blood in the phlegm due to damage to the bronchial mucosa. COPD can progress to respiratory failure if not well controlled. Bronchiectasis is a condition in which the bronchi are abnormally dilated, causing mucus to stagnate and creating conditions for bacteria to grow. People with this disease often have a persistent cough, cough up a lot of phlegm in the morning, and in some cases may cough up blood due to damage to the bronchial wall. Congestive heart failure can cause a persistent cough at night or in the morning due to fluid buildup in the lungs. When the heart cannot pump blood effectively, fluid can build up in the lungs, causing shortness of breath and a cough that is pink or bloody. This is a dangerous condition that can lead to pulmonary edema and heart failure if not treated promptly. Other conditions that can cause a persistent cough or coughing up blood in the morning include severe lung infections, damage to lung capillaries due to autoimmune diseases, or lung injury from inhaling toxic chemicals. If you have a cough that lasts longer than 2 weeks, especially if you cough up blood, have chest pain, have difficulty breathing, have unexplained weight loss, or feel tired all the time, you should see a doctor right away. These symptoms can be signs of serious conditions such as lung cancer, tuberculosis, or chronic lung disease, and early diagnosis increases the chance of successful treatment. Dear all, being proactive in identifying warning signs is the key to helping us prevent dangerous diseases. Cancer is not a death sentence if we detect it early and treat it promptly. Listen to your body, take care of your health and that of your loved ones. Don't let indifference rob you of the opportunity to live a healthy and happy life. Thank you for listening. Don't forget to like and subscribe so we can continue sharing helpful advice together. Thank you for watching, and I'll see you in the next video.